The night before my first clinical placement, I couldn't sleep. I wasn't exactly panicking, but I had so many questions. What if I messed it up? What if I didn't know anything? What if I didn't know enough? What if they think I don't even belong there? So if this sounds familiar and if this is you, you are not alone. Today, let's talk about 10 things that I wish someone had told me before my first clinical placement. You are not there to prove that you are already a nurse. You are there to become one. So it's okay to not to know everything. All you need to do is to observe and reflect. You are going to see different nurses doing things differently, which is a gift, not a confusion. Write down everything, all your questions, if you've seen any new scenarios, if you have seen any new medication or any procedures. Put everything down in your notebook and you can reflect on later. One more important thing, this is your time to have hands-on experience. You've already done labs, you may feel nervous, but doesn't let that hold you back. No one is 100% perfect, no one is 100% confident. So be proactive and be curious. And yes, we nurses love to teach our young, especially when they're curious and proactive. If you're wondering something, ask. Your preceptor and your facilitator may have heard these questions before. Asking questions shows that you are interested. On the other hand, not asking anything and staying silent may be interpreted as disinterest, even if you are trying to be polite. Don't worry if you sound silly or your questions might irritate someone. You are a student and your job now is learning, and we learn by asking questions. Talk to your facilitator, let them know how you're feeling. They are your first point of contact. If you're unsure about anything, if you're struggling with your learning goals, if you are not very okay with your placement environment, talk to your facilitator. Talk to them early. Please do not wait until week 4 to tell them that, hey, I was struggling with this for a long time and now I need some solutions because I'm finishing my placement. That probably won't give you a lot of options. But talking to your facilitator early and often and clearly will give you a lot of advantages. You know those learning goals you have? They are not just paperworks. They are your compass. So reflect on them every single day. Reflect on them like, have I done anything to achieve those learning goals? Or did I just take a step forward in any of them? It helps you feel grounded and focused, even if your shift feels chaotic. Even if you have a rough shift, reflecting back and knowing that you have achieved one of those learning goals or move forward to achieving, that is growth. That is going to give you a lot more confidence and energy to move forward. You cannot pour from an empty cup. So you need to take care of your mental and physical health. For physical health, you need to eat real food. Not just caffeine and vending machine snacks. You are learning and your brain needs constant, steady supply of glucose to stay focused and sharp. Running on cortisol and coffee is not sustainable for long term. So what I would do, I would pack a snack box. Some healthy snacks like carrot and hummus, a piece of dark chocolate, nuts, fruits. You need them to give you that boost of energy when you don't have enough time to take proper breaks. And that you need to take your breaks. I know some students stay with their RN if that's too busy and don't take their breaks, but you are a student, you are learning, so you need that 10 minutes. At least take 10 minutes, take a rest, take a breath and reset, then come back. Sleep is not a luxury. It is a requirement for learning. You need a brain that is sharp and focused, and sleep is very important in that area. If you are on a night shift, try not to take any day appointments or any day jobs, because sleep sharpens your brain and clinical placements demands your full attention. So, placements can be intense. That's why you need to do something to take you back to yourself. Meditate, stretch, take a walk, do something gentle like this to make sure that you are grounded and you are focused. So make a small habit out of any of this. This will protect your mental health and helps you process the day. So you may already know this, but real life nursing is unpredictable. You may have a lot of interruptions, like emergencies happens, families needs help, patients fall. As a student, you observe how your nurse adapt and adjust. Take notes. Time management is a skill that can be learned. It is not automatic. It won't come naturally to you if you are a completely new nurse on the floor. So you need to take notes on what works. Try to mimic the strategies that you think works, and you will get better with experience and with time. I know it can sometimes feel a financial burden, but staying close with your site, your placement site, is going to save you a lot of energy. And when you are in clinical placement, energy is gold. If there is any way that you can stay closer to the site, even a portion of the time, it's worth it. Clinical placements are exhausting in a unique way. They demand your full attention. You are learning and you are adjusting to a new environment. So that takes up a lot of mental and physical energy. If you can, try and focus on your clinical placement only. Try not to work any extra shift or any other jobs during your placement. Overcommitting may affect your ability to learn. If you are feeling nervous about your first clinical placement or whatever placement you are in at the moment, you are not alone. I was there, but there is the good news. You don't have to be perfect. You just have to show up, be curious, and keep learning. You are becoming a nurse. That takes a lot of support, a lot of time, and self-compassion. So in a nutshell, be kind to yourself. Take care of your mind and your body. Talk to your facilitator. Reflect on your learning goals. Reflect on your day every single day. And make sure that you are familiar with your learning goals. You've got this. I'm cheering you every step of the way. If you found this helpful, hit the subscribe button. There is more support, real talk, and gentle guidance coming to your way. And I will see you on the next video. Bye-bye.